60 Minutes with Angela starts right now.
Now, if you're watching me and you have a daughter, a teenager, or you know of any family who has a teenage daughter who's of menstruating age and complains incessantly about painful periods, this program is for you today. Endometriosis and uterine fibroids are the two areas we'll be looking at. As far as endometriosis is concerned, it affects over 2 million women in the United Kingdom, mostly between the ages of 25 to 40, but here in Nigeria, we're seeing them younger now in their teenage years. In the United States, 6.3 million women are affected by endometriosis, and in Canada, over 1 million women. What are the statistics here in Nigeria? Well, hello and welcome. This is 60 Minutes with me, Angela Ajitumobi. Thank you for joining me on the program today. Now, my host today, Dr. Ayodeji Oluwole, is a consultant obstetrician and gynecologist with the Lagos University Teaching Hospital in Lagos State in the southwest geopolitical zone of Nigeria. He's also the secretary of the Lagos sector of SOGON, that's the Society of Gynecologists and Obstetricians of Nigeria. I asked him, what areas should we look at on our health series program this week? And he says one of the major problems that gynecologists in Lagos State, or in Nigeria for that matter, are seeing a lot of patients with endometriosis and uterine fibroids. And the interesting thing is, a lot of women are sitting at home in ignorance, suffering in pain, not knowing what to do. So, join me after the break as I count down 60 minutes with Dr. Ayodeji Oluwole, a consultant obstetrician and gynecologist with the Lagos University Teaching Hospital. Welcome back. Welcome, Dr. Oluwole. Thank you very much for coming back on the program.
Thank you very much for having me on your program.
I thought we should start with endometriosis because I think fibroids are a little more known by most women than endometriosis. So I researched it. It says it's an aggressive, benign, but debilitating disease condition resulting from the appearance of small pieces of endometrial tissue outside the uterus. I mean, break that down for us in simple English for those watching.
All right, thank you very much. Endometriosis is just the presence of the lining of the uterine cavity. That's the womb of a woman,
Yes.
where you menstruate from. When you have the presence of this tissue that's supposedly should be in the womb, outside the womb.
What is it looking for outside the womb?
Well, sometimes in medical science, you can tell.
Yes.
These things have been with the many theories, but we've not been able to put our hands on a particular cause. Most likely is what we call retrograde menstruation, where you menstruate and some of this backflow of blood flows back in from the womb to the tubes into the abdominal cavity.
Okay.
And implants around the womb.
Okay.
And
is that why they used to say when girls are menstruating not to use tampons but to use sanitary towels so that you can get a proper outflow?
Not necessarily.
Okay.
The reason for that mainly is because of infections. They don't want people to insert things deep into their private parts.
Okay.
Mainly for infection. But there's nothing you can really insert into the womb. It's not going to pass through the cervix, the neck of the womb, into the endometrial cavity.
Okay.
So this is just a natural backflow. Most times it gets moved up by the body. The body itself has a defensive mechanism that God has ordained to mop up certain diseases.
Yes.
But in some few people, these tissues, these things remain
Yes.
and can form endometriosis.
Okay. I've also read that they say it is difficult to deal with physically and emotionally. So let's talk about the physical part. There's a lot of pelvic pain. So for people watching now, if you have painful period, what can that mean?
Painful periods, basically we call them dysmenorrhea. You can have primary dysmenorrhea or secondary dysmenorrhea. Primary dysmenorrhea is what is so common amongst young ladies.
Yes.
There's no cause for that. It's an hormonal thing, prostaglandins, iatrogenic to the womb.
Yes.
Secondary dysmenorrhea means that you have a cause. It could be endometriosis, it could be fibroids, it could be infections, it could be an ovarian cyst, it could be other things.
Yes.
Now for endometriosis, the commonest complaint is pain, from mild to moderate to severe to debilitating or excruciating pain.
Where exactly is the pain? Is it below the navel? Is it where the pubic hair is? Or is it inside the vagina?
It's just basically around the pelvis, the lower abdomen,
Right.
mostly below the umbilicus,
Okay.
the navel.
Yes.
And but it depends on the severity and the spread. That's the unfortunate thing about endometriosis. It can also spread to the bowels, so it can affect where you're passing stool, it can affect where you're passing urine. It can spread beyond the bowels into the lungs. You can have blood in the lungs. It can affect. It can spread to the eyes. The way you see a young lady having a menses and also bleeding to the eyes, or to the nose, or any other part of the body. So that's, we call that metastasis. So it can spread. But those are the severe forms. The major ones we have are the simple, mild to moderate ones.
One of the things you said that caught my attention was that a young girl who starts her period can have it and she will be at home complaining of painful periods. The mother will be giving her paracetamol or telling her, you know, be strong. Women have been having periods all their lives. Why are you behaving as if you are the first? And then 10 years down the line, she's 26, she gets married, she tries to have a baby, she can't have. Is that mostly when they will start the investigation to know that something is wrong?
Yes. Unfortunately, we live in an environment where medical education is a bit on the low side. People are educated, but they're not medically enlightened. If you have a daughter, a 14-year-old, 15-year-old, who's always ill, anytime she does her periods, you should investigate. You should take the lady to see the gynecologist, and especially any form of menstrual pain that disturbs her day-to-day activity, schooling or going out.
So she's 14, she's 15, she started her period. When she's on her period, she doesn't want to go to school.
She doesn't go to school.
She can't do any activities.
Nothing.
It's not normal.
That's not normal. It's not normal. You should investigate. We advise that you should investigate
Okay.
to be on the safe side, because we found that these people usually have simple, mild endometriosis, which could have been treated easily there and then. But along the line, in 10 years' time,
Yes.
20 years time, when she wants to get married, it has not affected the tubes and their blood. And you have infertility, which is the long-term complication of endometriosis.
My goodness. So what is it looking for? How can it survive? I would have thought tissue in
Wrong place.
in that area. Once it gets out of that area, it will die off or it won't survive.
Yeah, but unfortunately, the mystery of the human biology
Yeah.
is different. As long as you have blood supply to any organ, once these tissues plant on any organ, basically around the womb, in the patch of Douglas that's below the womb, on the ovaries,
Yes.
the tubes, even on the intestine, they will get blood supply.
Is it true that even women who have had a hysterectomy can have endometriosis as well?
Yes, please. If it had been there before the hysterectomy and had not been treated, it would be there. But once you've had the hysterectomy
Yes.
and you've had your ovaries removed, then you're not likely to have any symptoms from it. Because
Okay.
the common symptom is pain. If you don't menstruate, you're not going to have pain. So depending on the age at which you had your hysterectomy, that's removal of your womb,
Yes.
and if your ovaries were removed, if your ovaries are not removed and they're there, you may still have some pain. But if your ovaries are removed, you're not likely to have pain, because the treatment for endometriosis is to stop the menses. It flourishes, it grows more every month, every year. The more you menstruate, the more it develops and it flourishes.
Okay, so every month when you're menstruating down there, the
Tissues.
areas where these tissues are spread all over your body are also kind of menstruating.
Yes.
Is that what you're saying?
Yeah. It can be so bad sometimes that you can have blood in the peritoneal abdominal cavity.
As a result of this?
Ascites, blood that you will need to have a surgery to remove. Sometimes it even gives them pleural effusion, fluid in the lungs, bloody fluid in the lungs. And unfortunately, quite a lot of them get treated for abdominal or tuberculosis.
Without knowing
that it's actually endometriosis.
So if people are watching now, because you just said this, they get treated for bowel, they get treated for TB. What should they do? Who should they see first? Should they come straight to the teaching hospital or a GP first to make the diagnosis? Is it
unfortunately, they see doctors outside. You know, we have two kinds of doctors in Nigeria, those in public service and those in private practice. My advice for young ladies, young women is that whenever you have issues that have to do with your menses, try to see a specialist. There's nothing wrong with seeing a GP, but some of our GPs have limited knowledge.
Yes.
So you should see a specialist, or you can tell your GP that you would like him to refer you to see a specialist.
Okay.
That you can get a thorough checkup. Because unfortunately, once you miss it, you get it for something that is not endometriosis. Especially TB, we have quite a lot. The last 5 years, we get it for tuberculosis, all because they have fluid in their lungs. And once you do an X-ray, you see fluid in the lungs. If you're not a careful doctor, a diligent doctor, when you have to take a proper history, way back, even to this extent of our menses, you will miss it.
So when the doctor is asking you some questions, sometimes you think, is this man crazy? I've come here with lungs, I'm coughing, and then he's asking me about my periods.
Especially a young lady in the reproductive age, it shows.
You know, a lot of parents are going to be panicking now, Dr. Oluwole. So let's look at it this way. She starts the period. Is it the first period painful, the second month painful, the third month painful?
Fortunately for young ladies, their first set of periods are not very painful.
Right.
Because that's they're coming to their reproductive potential age. And some young ladies will see the periods now, probably not for a few months again, it comes again. So it's not well established.
Right.
But once it becomes established, and you see a pattern that my daughter is always out of school, in a sick bay, or on admission, anytime she does her periods, her menses, it makes sense to look.
Because sometimes they will go to school, but they will spend the whole day in the sick bay.
Yes.
That's the problem.
That's the problem. Any pain during menses that warrants you being admitted, or the observation or admission, or disturbs your way of life, you should seek proper help. And like you said earlier on, it's passed down from generation to generation.
Yes.
Somebody will say, oh, my grandmother had painful periods, my mother had it, I had it, and I bring back to you, my children.
Yes.
So why are you being lazy and things like that? No, she's not lazy. She probably just have endometriosis.
Do we have any idea of the statistics here in Nigeria?
Yeah, we don't have an exact figure because our statistics are not very...
record keeping is poor.
Is so poor, but we have hospital-based studies. There was a study that was done once in our hospital, and we found out that for every 100 infertile women who come in for infertility, about 10 or so of them will have endometriosis. Even coexisting with uterine fibroid, that we'll discuss later.
Are you serious?
Yeah,
so in fact, this endometriosis can be there not alone with other conditions.
Yes.
Will it be the one that has caused these other conditions?
Infertility, yes. It's a long-term complication because sometimes when you have moderate to severe endometriosis, you have what's called adhesions. When the tissue they stick together, the tubes get passed out to the womb, the ovaries are involved, it can be enlarged, causing ovarian cyst or endometrioma, what you call chocolate cyst. And the whole pelvis can be plastered together, causing adhesions. They can lead to infertility. So some of them present with infertility or chronic pelvic pain. That's pelvic pain that's been on for a long time, or pain during intercourse, dyspareunia. They always, I'm always having regular sexual intercourse with my husband.
Yes, it's painful.
It's painful. And by the time you examine them, you do laparoscopy for them, it's endometriosis.
They say it's a long-term chronic condition. Is there a cure for it?
Well,
no real
there's
cure.
no real cure for it medically.
Yes.
But naturally, once you enter menopause, it stops.
Because of course, no menstruation.
No menstruation again. But there are drugs, we have medical management, and we have surgical management.
Okay. So if you say when there's no menstruation, it stops, Can I take that to mean that when a woman is pregnant too and is not menstruating, incidences of endometriosis will be reduced, or will they go into hiding and then wait until the baby comes out and resume?
If you're lucky and you had mild endometriosis that are not affected the tubes and you marry and you get pregnant, fine, beautiful. That means that you've got 9 months of treatment, that's 9 months of no periods, and a few months of breastfeeding,
Yes.
if you're lucky. So almost like about a year. The incidence will not go down, but the symptoms will greatly reduce.
Symptoms being the pain.
That pain during menses, pain during intercourse, pain during maturation or defecation.
Yes.
But the symptoms generally would get better. And that's why some mothers say that, okay, don't worry, when you get married, you have your first baby,
The pain will go down. Yes,
yeah,
I've heard that
for
too.
the mild cases, that will probably treat them. Because once you're pregnant for 9 months, and don't forget that Nigerians will deliver every other year. So that will treat mild cases. But severe cases, once you deliver and you finish your breastfeeding, it may come back.
Okay, so is it advisable that, look, to parents watching now, if you have a daughter who starts her period, she probably needs to see a doctor anyway, just to be on the safe side, that look, everything is working, ticking fine, you know, in that pelvic area, before she starts the real journey into womanhood. Is that advisable?
No, that would be too much body.
Okay.
If there are no complaints, no issues, you don't need to go see it.
Okay.
Because menses is a physiological and a natural process in womanhood. A young girl, from a baby to a girl, to a young lady, to a young woman, to a wife and to a mother.
All right. Join us again after the break.
It is difficult to respond to that question.
Angela, that's a great question.
Great question, Angela.
Angela, that is a very great question.
That's a great question.
Okay, that's a great question.
Yeah, very good question.
That's a good question.
This is an interesting question you put.
60 Minutes with Angela. Again, answers to every question you always wanted to ask.
Welcome back. If you've just joined us, it's 60 Minutes with me, Angela Ajitumobi. On my hot seat today, Dr. Ayodeji Oluwole. Now, we're still on endometriosis. I understand it causes painful or heavy periods. Why not both?
Well, symptomatology of endometriosis depends on the severity and the extent of spread. The commonest symptom people complain about is pain. The next one is probably some irregular bleeding. Now, depending on the extent of the spread, they may complain of constipation or painful defecation or painful maturation, pain during intercourse, like I said earlier on. Those are the major complaints. So it's the extent and the severity of the disease that determines the clinical presentation and what they complain about to the doctor, to their parents, before they see the doctor.
Okay, but it's not in every case that it will cause infertility. They say that the fallopian tubes or the ovaries may be damaged. How does that damage arise?
It's a mystery also, because you can have a mild endometriosis and it can cause infertility. And you can have severe endometriosis and no infertility. So it's a mystery. I think it's natural selection and the intrinsic potential of the woman herself.
Yes.
We've seen people who had severe endometriosis, yet they're fertile. They do get pregnant and probably discover that maybe when they're about delivering or doing a cesarean section.
Yes.
And you have somebody who has a mild endometriosis and the two tubes will be blocked, or one will be blocked, or it can cause ectopic pregnancy.
Yes.
The thing about it is that you never can tell how you're going to present until you see what damage has been done there. Basically, we know that people, some people even have endometriosis and they live with it throughout their lifestyle, have their kids, and they will not even know that they have endometriosis.
They say there's a lack of energy, sometimes they're depressed.
Yeah. Of course, regular pain can cause a lot of psychological problems for some of them. Some of them don't want to see their periods. The anxiety that comes in is, oh, I'm going to see my period next week. They're already anxious, apprehensive. So if you're not careful, it can lead to a lot of psychological problems. And some of them are even referred to the psychiatrist, who will probably now discover that she has endometriosis and send them back to the gynecologist. Because some people think, oh, anytime she wants to see her period, she goes into a fit, into a particular withdrawal syndrome.
Yes.
But because of the pain she's going through,
pain in the back,
pain in the back, lower abdomen, sides, which some mothers don't even appreciate. They don't look at, oh, you're just being lazy, you're just being,
Yes.
go and take paracetamol, go and take Buscopan,
Yes.
go and take Buffet. No. Go and take Feldin. No. You should take her to see a specialist.
Okay. And if they present with this pain, how do you diagnose it? Is it a physical thing or you have to do surgery?
The diagnosis for endometriosis is twofold. One, from the history. I mean, that's what our job is as medical doctors. We sit down and listen to you,
Yes.
ask you a few prodding questions, and see what it leads us to. Most times, if you see a young lady, a young woman who is always complaining about excruciating pain during her period, that raises an alarm in our head, and then we okay, fine. Most likely she has endometriosis.
Yes.
On physical examination, in the bad ones, if you do a pelvic examination, that's a
Yes.
vaginal examination, you may feel the nodules.
Along the way.
Around the pelvic, along the private part, the vagina and the patch of Douglas, you may feel the nodules, big nodules,
Yeah.
or you may have what's called an enlarged ovary, endometrioma. Sometimes
Yes.
they bleed into the ovary and they form a cyst containing chocolate fluid.
Yes.
That's still blood. But the gold standard, the only way to diagnose endometriosis is surgical laparoscopy. It's an investigative procedure where you make a small incision under the umbilicus.
That's the navel.
That's the navel, and you put in a telescope to look into the peritoneal cavity, and you see everything in the peritoneal cavity on a screen, on a TV
Yes.
screen, and you can determine the extent.
The camera is at the
It's a
tip.
telescope, yeah, it's a
telescope.
fiber optic telescope.
Yes.
You can have a rigid telescope, whatever we have in the hospital.
Do you have it in Nigeria?
Oh yes, they are readily available both in
At
government hospitals.
Luth?
We have it at Luth.
So you do laparoscopy at
Yes,
Luth?
both diagnostic and therapeutic. That's to diagnose the problem and also to treat the problem.
Okay, so laparoscopy will diagnose it.
And to confirm the diagnosis.
To confirm the diagnosis. And how can you cut everywhere where this thing is hiding in the body?
The major treatment for endometriosis is medical. The surgical aspect is just to alleviate symptoms or minimize sequelae, the complications.
Right.
Once you put in the laparoscope, you look into the peritoneal cavity, you see the adhesions, you can break down the adhesions,
Right.
whether to the bowels, or to the ovaries, or to the tubes, or to the patch of Douglas. Once you're well trained, and you can break down these adhesions to reasonable and safe extent for the patient, but that patient will, and you can take biopsies.
Yes.
You can take some of these nodules just for surgical diagnosis.
Yes.
But you still have to come back to medical management where you can take drugs
Yes.
on a regular basis. And the commonest drugs we give are the oral contraceptive pills.
What do they do to the thing?
Well, this is supposed to prevent ovulation and minimize menses. So you have a group of progesterone-based drugs like oral contraceptive pills.
When you say progesterone-based drugs, I'm sorry to keep
Yes.
butting in because I understand that estrogen is the hormone that makes endometriosis thrive. So in giving progesterone, you're kind of killing away the other one. Is that what you're
not
doing?
necessarily. Like the combined pills,
Okay.
they contain both estrogen and progesterone. But what the combined pill does is to prevent ovulation. I mean, not prevent menses, but prevent ovulation. That will minimize the symptoms. But the best drugs to use are we call them the GnH NRH analogs. Zoladex, Goserelin.
Yes.
We'll give this for a maximum of 4 to 6 months, and you're not follow up on other progesterone-based only drugs. The essence is to prevent ovulation and minimize the menses.
Right.
Once you do that, the extent of growth of this endometriotic tissue, whatever
Yes.
it is greatly reduced.
When you say prevent ovulation, minimize periods, I'm assuming then that the woman will have no further plans to have children.
Not necessarily. For instance, young ladies who are not married,
Yes.
they probably want to get married
And
later in life and
yes.
have kids. So, but if you treat them for like a year or 2 years and the symptoms are abated, you can stop the drugs.
And then they can have
and
a
then
normal.
they can have the normal. They can have the normal.
Can they still have the thing back? Can it still come back after they've had all their children?
It's unusual if you've treated it to a reasonable extent where the tissues have been really, really repressed, embedded, and you've had like 3, 4 kids or 2, 3 kids, be that as they may now, for them to come back. That means that the extent must have been really severe. But for most mild to moderate cases, you probably won't come back again. The mistake some of our colleagues outside make is you treat them for like 2, 3 months and you stop. No. Sometimes they need to be there for like a year, 2 years.
On
these
these
pills.
hormone medications?
Especially for young ladies, we're not ready to have kids now.
Yes.
We have a severe form of the disease.
Is that surgery not going to be cumbersome? I'm trying to imagine opening somebody up, you find some somewhere, then there's some somewhere again. Are you going to open up?
No. Funny enough, laparoscopic surgery is like minimal access surgery.
Okay.
The one they call penile surgery.
Yes.
In the layman's parlance. It's just a small opening around under the umbilicus with 2 additional holes.
Yes.
Less than 2 cm, where they have external probes.
And you are watching it on the screen.
And you're watching it on the screen, trying to break down the adhesions.
Yes. Is the person awake or
No, the
asleep?
person is under anesthesia, general anesthesia.
Asleep.
There's no way you can do that under. A patient is going to be, patient is on general anesthesia, totally relaxed, and the surgeon with 2 other assistants
Yes.
will be operating. It's a meticulous surgery, and the skills are already available in Nigeria.
Now, let's look at the complications. They said difficulty getting pregnant or not at all. Will surgery guarantee that you'll be able to get pregnant or just improve your chances? Are there any definites?
Inability to conceive, infertility, is a long-term sequelae, long-term complication of this condition, and
Yes.
depends on the extent of the injury to the tubes. If you're lucky, the adhesions are just at the end of the tubes. We call it fimbrial adhesions.
Yes.
This can be broken down easily, and you can conceive. But if you have like what we call a semi-frozen or a frozen pelvis,
Yes.
everything is matted together.
Yes.
I mean, there's no surgeon that's going to try to become a hero and cause further damage.
Yes.
So just going to look at that and say, okay, fine, it's a bad case. But the good thing about medical science is that you cannot go for IVF.
The function of the tube is just to allow the egg to travel.
The fertilization occurs in the tube.
Okay.
So it's a place where the egg and spermatozoa meet
Yes.
and come together and fertilizes.
Yes.
And the egg swims back into the uterine cavity, into the womb.
To implant.
Yeah. So if the tubes are absent now,
Yes.
that means there can be no connection between the spermatozoa and the egg. So
Right.
that's why you have to do an IVF.
Right.
You fertilize the egg and the sperm outside, implant it back into the womb. Fortunately, endometriosis does not affect the uterine cavity, that's the womb.
I was
itself.
just going there because I was thinking all this uterine talk. What is the guarantee that you won't have a miscarriage? Does anything affect the
Cavity
fetus?
itself?
Yes,
No.
when it's now implanted in the.
No. That's why the definition of endometriosis is presence of endometrial tissue outside the endometrial cavity.
So once you have your children, you stop breastfeeding, your period starts again, it is likely that it can come back.
Yes, likely, but most times very unusual.
All right, now let's talk about uterine fibroids. I think that seems to be more popular because more people know about it. I'm trying to think of all these myths. You know, some stories you hear about women who have been pregnant for 2 years, carrying this big mass in their stomach. Most of the time, those masses may be fibroids, won't they?
Yes.
Why do you think you don't see these people early enough in the hospitals?
Very good question. It's a mystery to us ourselves, and because I wonder why somebody would have a problem, the problem, they know the solution, and they go away. I think it has to do with social environment, socio-cultural.
Yes.
People generally are afraid of surgery. I mean, if you tell me that I need to go for surgery, I'm probably anxious too as a doctor. It's natural. But
Yes.
it's got to do, we believe so much in faith healing. So it's a socio-cultural problem. People want to go try something else. Let me go and see my pastor.
Yes.
Let me go and pray about it. And try alternative means. And the condition is there and it's getting worse.
So by the time they come to you,
Eventually, by the time they come back, they are huge masses. So it's a big problem in this environment.
now these two conditions, endometriosis and uterine fibroids, they're both saying benign. That means that they're not cancerous. But can they be? Can fibroids be?
Yes, very few, but 0.1% of fibroids can now progress later to what's called a sarcoma.
Right.
That's very, 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 very rare. I've only seen one case in my 20-something years of practice.
Now, one more myth. Is it possible to pass out fibroids in waste, in feces? I see people selling herbal preparation and they say, oh, don't worry, it will melt the fibroids, and when you go to toilet, you pass it out. Is it possible?
That is one of the greatest frauds in modern day history in Nigeria. There are quite a few centers in Lagos
Yes.
where we hear that, oh, come in, they're going to insert something to your private part, it will melt the fibroid.
Yes.
I mean, that's absolute.
Have you seen
false.
any damage by it? I know
yes,
a
that's what I was
gynecologist.
They insert all these caustic corrosive chemicals.
Pineapple. Have you heard of?
Some pineapple, they're corrosives. And they now cause what we call gynetria. Gynetria means that once you start something like acidic into the private part of a woman, the vagina, it melts the tissue and gums it together.
So the vagina won't be open again?
Obviously.
There will be no passage?
No passage. 1, the fibroid is still there. 2, you can't menstruate again. 3, you can't have intercourse with your husband. 4, there will be marital disharmony. 5, marital breakdown.
No children, obviously.
So it's a big problem. It's so sad that even educated people do. I mean, I'll tell you a case now. I had a case of a petroleum engineer.
Yes.
And husband a child accountant. And she went somewhere in some gutter. And they paid man some huge amount of money. They said they started something that will melt the fibroid. And how these things happen, we don't even understand. Eventually they will come back to Luth or to other public hospitals where this, and to correct the surgeries, it takes about 8-9 hours because we do them in combination with the bones and plastic unit surgeries. Because you have to do vaginoplasty, you have to also do the fibroid operation again, and do the vaginoplasty and make sure that you can create a channel from the vagina back to the womb. Because they're putting an acid into the vagina. So what they find,
you've taken my breath away. You've run ahead.
It's a big problem in Lagos.
In certain things,
corrosives into the private part of the woman. What it does, of course, if you insert acidic corrosives with caustic soda,
yes,
it's going to form some tissue around. So to them, psychologically, I'll pass out the fibroid. But these people that are using these things, they themselves know the truth because they say for the fibroid in their tummy. Recently, we did a case, myself, one of my colleagues,
yes,
and she came from Cross River to Lagos to meet this person somewhere in Lekki. They're all over Lagos. Of course, they're quacks in the first place, but there's no specialist gynecologist that will do that. Yes. There's no properly trained doctor that will do that. I will say that. And I keep on telling people that when I come across that fiber, I say, why don't you Google it, read about it?
Yes. Google is your friend.
Read about it. If you have injections or tablets you can take that will cure it, fine. But don't go and meet all these quacks who will now further complicate matters for you.
And want to melt it. Join us again after the break. So what is 60 Minutes with Angela all about? It's not an interview. I like to think it's a conversation between two people making the news, people who are in the news, and those who become the news. And the whole idea is to inform, to educate, or to clarify, as the case may be. It is an art getting people to answer the questions that everyone is thinking in their minds. And that's what we try to do on 60 Minutes with Angela. I ask all the questions that everyone's thinking about and no one wants to voice. All the questions you always wanted to ask, you get those answers on 60 Minutes with Angela. Every week on this station, 60 Minutes with Angela, getting answers to every question you always wanted to ask. Welcome back. Well, my concluding moments now with Dr. Ayodeji Oluwole. So, with uterine fibroids, what are the general symptoms?
The symptoms depend on the site and location of the fibroid. We have 3 major types of fibroids. One outside the womb, we call them subserous. One in the muzzle, intramural, and one in the cavity called submucous.
Yes.
The common symptoms are 1, people have this feeling, bloated feeling, my tummy is swelling, there's something hard in my lower abdomen, or pain during menses, or pain anytime during defecation, or excessive vaginal bleeding during menstrual period, where they pass clots, heavy clots. Some of them it's so bad that they can't go out to work. Then some of them may have what's called frequency, passing urine more frequently because the bladder is closer to the womb as the uterus, and they pass urine more frequently than they would normally have. Then some of them are, if you have the fibroids at the posterior part of the womb, it can cause constipation. But the commonest symptoms we have are abdominal swelling, pain, excessive vaginal bleeding.
What is the connection between fibroids and pregnancy? Can it prevent pregnancy? Can it cause miscarriages?
Yeah, basically fibroids have not been known to prevent pregnancy, but they've been associated with infertility. But to find out that there are quite a lot of women who are infertile
Yes.
also have fibroids in this environment,
Yes.
in the tropical part of the world. Fibroids can cause miscarriage, yes. If you have multiple fibroids in the womb,
Competing for space with,
yeah, it
with the baby.
it can lead to miscarriage.
yes.
But fibroids basically in itself will not prevent it because some people get pregnant with huge fibroids. They do get pregnant.
And what happens when they have the baby?
Well, even during pregnancy it can be a bit turbulent. It can have what's called red degeneration in pregnancy where there's a diversion of blood supply go from the fibroids to the baby for obvious reasons because
Yes.
the baby is the original owner of the womb.
Yes.
And so they can go into what is called degeneration. And that can give them a lot of pain during pregnancy. Excruciating pain. The warrants have been admitted. We call it red degeneration
Right.
in pregnancy because of the fibroids in the womb. They
Yes.
can also have heavy bleeding after delivery when the uterus fails to contract because of the multiple fibroid nodules in the womb. Because
So
it's uterine anatomy.
Okay, it can't go back to its normal
Yeah,
size.
so you may not contract very well and you can bleed heavily if you're not careful as a doctor.
What causes fibroids?
The truth is we don't know what causes fibroid, but we know that it's a problem with one, it's genetic, it's racial, and geographical.
It's genetic, it's racial, it's geographical. Is that
Mainly
means that
black
only
women.
black women
Mainly black women. Some whites have it,
in
but
Africa or black women anywhere in the
black
world?
women anywhere in the world, but mainly in Africa.
Genetic, if you have it in the family.
Yeah, it's only for women too, black men also.
Hmm.
It runs from grandmothers, great grandmothers, grandmothers, mothers, daughters, and even your unborn daughters may have it. Once you're a black woman, the chances of having a fibroid is so high. Some people have just tiny nodules all
Yes.
through their life. They may not even know they have fibroids. They may not even have any symptom.
Yes. So
Like that.
a lot of women carry fibroids who
yes.
don't even know.
They
When will you discover it as a doctor?
Some-
When they're pregnant or?
Some is just an accidental discovery. Maybe they had a pain, they went for a scan. Oh, madam, you got some fibroids. That wasn't their complaint.
Yes.
Or they're pregnant, they register for antenatal, madam, we go and do a scan. She goes for the scan and she comes back. Oh, she's got some fibroids. She never knew she had fibroids because she never had any symptoms.
Is it true that not all fibroids need to be operated?
True, yes. If you have tiny fibroid nodules, they're not symptomatic.
Yes. They're not giving you any problems.
Any problems,
Yes.
either as a young lady or even after you compare to your family. Maybe in
Yes.
your 40s, early 40s, you got your 2-3 kids, you have everybody's not disturbing you. Let's bring dogs down. You don't need to take them out. It's only when they disturb you and you become symptomatic
Yes.
or they disturb your health, then you should deal with it.
Now, they say the age group is between 30 and 50. Is that true?
No.
People, younger women are having
I've
it
seen,
now.
A 15-year-old girl, young girl,
15
Yeah,
with fibroids.
she came in with urinary retention, and that was how found out she had a fibroid.
What do you mean urinary retention? She wasn't urinating enough
She wasn't. No, she couldn't even pass urine
at all.
at all. So when she came into the emergency in Louth, we had to pass a catheter for her, and we found out there was a mass. If you go and do a scan came back as a fibroid, and was
Was she a chubby kid?
no slim. That's the youngest person I've ever seen in my life. The fibroid, the 15-year-old SS2 student in the secondary school. I was quite amazed myself.
Yeah. So did she need surgery?
Well, we told her she needed surgery, but and that was the end of it. I never saw it again. I think her parents.
As
were
usual,
too shocked,
people
as
are
usual.
scared. So all these things can be treated here. You know, I still find people going to the UK for surgery on fibroids, to India, to the UAE now. Are these surgeries available here, or, you know, people say they will die if they do it here? That can't be true.
It's unfortunate that such things are happening. Fibroids is it's like malaria. It's a local problem. Fibroids is a local problem. It's an African problem. It's a black woman's problem. And I find it very funny because, like in Louth,
Yes.
I have residents under me who do fibroid operation week in, week out. No complications.
Oh, it's not even something reserved for the top man like
No,
you.
No.
Residents can
Residents
do
do
it.
it. Medical officers do it in general hospitals. Once you're trained to do it properly, under
Yes.
supervision, you can do it. And hundreds are done every week all over Nigeria, all over Africa. So there's no way people out there can be more versatile in that surgery than people do day in, day out here in Nigeria.
And because it's a black thing,
Yeah.
you
I
guys
mean,
have
how
been
about the
dealing.
few cases that were done abroad that they had to fly them back, that got complicated, and we have to resolve the complications.
What do you
in
mean
Nigeria.
got complicated? Isn't it straightforward? You go there, you cut the thing off, and
It's not so straightforward like that sometimes. Complications can arise from the surgery, they can
Yes.
bleed heavily, You might need to remove the womb, it can become infected. And of course, for Nigerians who want to remove fibroid, they want to preserve their womb
Yes.
for fertility
Purposes,
potential.
yes.
And once they tell them over the outside Nigeria that, Madam, we need to remove your womb, then they stop the treatment and they come back home to Nigeria. That's when they now have the faith in Nigerian gynecologists. In Africa, we place a lot of premium on childbearing.
Yes.
So we don't offer them removal of the womb. Of course, that's the curative treatment. You remove the womb, there's nothing's going to grow.
But you will ask the question, have you had kids? Are you still going to have? That will affect the decision you take.
Definitely.
They say it occurs more in overweight or obese women who have increased levels of estrogen. So weight is an issue.
The studies can be funny. There's something we call randomized control trials. We find that whether you're slim or you're fat, you can have fibroids. It's commoner if you're a bit on the obese side, on the big side, because of the estrogens. But there's really no scientific basis. I see quite a lot of slim women who have a huge, massive fibroid.
Yes. They say menopause is also good for fibroids. I mean, if that's a positive thing to say.
Well, once you hit your menopause,
yes.
It means you're not menstruating again, automatically the fibroids shrink.
Why? There is no blood supply.
No blood supply, the hormones have gone down, the estrogen is low. The fibroids grow more because of the estrogen and the blood supply during your reproductive age.
Yes.
So once you hit your menopause, maybe in your late 40s or early 50s, these fibroids will shrink. They won't disappear, but they will shrink.
Oh, they will still be there.
Oh, they will still be there. It doesn't disappear.
But you won't need to remove it.
If you're not having issues with it.
Okay. And can medication help to relieve the symptoms without the need for surgery, or is surgery the ultimate goal?
It depends on the symptoms. The symptomatology determines the treatment.
Yes.
If your complaint is just pain during menses and fibroids are not big enough, it can be medically treated. It can give you painkillers, analgesics.
Can medication shrink the fibroids? Does anything shrink it?
Yeah, we have a particular injection that shrinks it, but it doesn't cure the fibroid. It shrinks it so that you can have surgery. It's for the huge ones. Now people mistake that for treatment, for curative treatment.
Yes.
And if you take this injection and you don't have surgery, this fibroid will grow voraciously and
bigger.
Back.
Bigger than before.
Bigger than before. So these injections are actually meant to shrink it to a reasonable extent so that can make the surgery easier for the surgeon. But Nigerians trust Nigerians we turn it upside down and say, oh,
yes.
Can I have an injection that will cure the fibroid? There's no injection to cure fibroid. You can shrink it to a reasonable extent that will make the surgery less bloody and improve your chances of survival or blood transfusion.
Why is it so bloody? Is it because blood vessels might be around where the tumors are?
Yes, definitely. I mean, the womb itself it's like it's a tissue, it's a big tissue.
Yes.
That's two big internal arteries supplying it from the aorta.
Yes.
And any cut, even our fingers, if I cut my finger, it's going to bleed. Now, the extent of bleeding is determined by the extent of blood supply to that area. So the uterus is well supplied.
Yes.
And the more you cut, the more they bleed. But there are devices we use, we call it tourniquet, rubber tourniquet, to impede the blood supply during surgery while we're cutting the fibroid nodule, so to minimize the blood loss. And most, if not all, gynecologists in sub-Saharan Africa are versatile with this technique.
Now.
So
we have it in Nigeria.
Oh, yes.
You have it in Louth.
Everywhere. Not even any private hospital that does mammectomy or any properly trained doctor will know that you have to put a tourniquet to minimize blood loss. So gone are those days that people should die from bleeding from fibroid operation.
Yes, not anymore.
Not anymore.
That was one of the greatest fears, that you will bleed to death on the table.
Yes.
That used to be a real fear.
Yeah, that used to be a real fear. Many years back, before the advent of this tourniquet at the neck of the womb, at the neck of the cervix, we call it isthmus. If you cut the fibroids, they bleed a lot. And once they bleed a lot, if you don't have enough blood pints available,
in the
you may lose that patient. So with the advent of tourniquets, mammectomies and fibroid surgeries are now much safer.
Considering that you're seeing them more often in women who are overweight or obese, does diabetes type 2 pose a risk in terms of the treatment or in terms of surgery, if you're going to do surgery?
Any medical condition coexisting with the fibroid will have an effect. For instance, if you're hypertensive, if you're diabetic, who are diabetic are poor healing. So if you're diabetic, the advice is we'll have to make sure you're well controlled over a period of time before we schedule you for the surgery.
So you
otherwise,
want,
it's got nothing to do with the surgery itself. But the healing may be a problem because of excess sugar in the system. So you need to be well controlled by the endocrinologist. And once you're well controlled on diet and drugs, then you can come in for your surgery.
so it's an endocrinologist that will
Yes.
determine when the surgery will go ahead.
When they're well controlled, then I refer them back. Like in Luth now, where we call what's called multidisciplinary management.
Yes.
I'm a gynecologist. I have a patient who's diabetic. I will refer to my colleague who's a physician. And the person, okay, I have this patient, she's coming for surgery, but she's diabetic. So please help to achieve control. So he achieves control over a period of time. He's confident that she's now well controlled. She can control herself on diet or drugs. Then they send them back to the gynae department, who's scheduled them for the surgery.
Do you think we should include all these things in primary health care? I'm asking that because, you know, in other climes, primary health care is what it is, primary. You guys don't see anybody until they're almost dead, you know? So I'm thinking of how can we draw in more women in the rural areas, even, as you said, educated women in the urban areas who are resisting the need to seek proper medical care for these conditions, which you have said are treatable and can be managed at least to give a better living standard to the women.
Well, I think the government on its part has a big role to play. First and foremost, education. The government must have a policy about the health of its people. In fairness to some of our past ministers of health, like Professor Oluwole,
Yes.
who was a front runner for primary health care, whether it's in the rural urban areas, primary health care is the gold standard. Any part of Nigeria should have access to good, not just health care, good basic medical health care. They should have access to it.
For those watching now and who have or know somebody who has experienced either of these things we've discussed today, you know, Lagos University Teaching Hospital Luth is a tertiary institution. How can they get to Luth? I mean, do they go now to their GP and say, refer me? Or do they just come to the emergency department of Luth and say, look, because if they've been experiencing all these things we've talked about the last 6 months, their GP hasn't referred them, can they just come straight to Luth and...
Well, you're right. Luth is a tertiary hospital. You just can't walk in.
Yes.
It needs to be referred. There are 3 tiers of healthcare:
Yes.
primary, secondary, and tertiary. But what they can do, and what I tell people is that you cannot overflog tertiary institutions.
Yes.
You've seen it. We need private hospitals and GPs all over the place. But if you have a problem and you're seeing a GP and you're not getting better, you have a right. Unfortunately, Nigerians don't know that medical right.
Yes.
You have a right to ask your GP, please can you refer me
To see
the
a specialist.
secondary healthcare or tertiary, whether you have a general hospital or you have or FMCE or a tertiary a teaching hospital. Please can you refer me to see a specialist? You have that right.
Yes.
Now, if the doctor refuses to do that, you can report that doctor to MDC.
Really,
Yes,
to the
it's your right
Medical
to ask
and
for a
Dental
referral. Oh, yes.
Practitioners
Oh
Council.
yes, you should. I mean, when the patient asks for a referral, you are under obligation and oath to refer that patient for proper health care. Because the patient is not getting better. You don't refer the patient. I said, please can you refer me to the next level of care?
Yes.
You have that, it's your right.
Yes.
So you should refer. But if in case you don't get that kind of treatment, Luth is a tertiary hospital where we run about 12, 13 gynecologists in 4 units. We have gynecological clinics in the afternoons on Mondays, Tuesdays, Wednesdays, and Thursdays.
Yes.
And you can come in if you're lucky, come in early, you can go to the emergency, ask for a referral letter
Yes.
to the gynae clinic. They will give you the referral letter.
At least it's something to somewhere to start.
Yeah.
If you've been watching us and all the things that Dr. Oluwole has said, you know, you've mentioned pain, you've talked about teenage girls and endometriosis. These are things that we shouldn't sit at home and be nursing. You should actually do something about it.
Sure.
So they can walk into Luth, go to the emergency unit, as you said, and ask for a referral, and then they there will
The
determine.
doctors in the gynae emergency would refer
Yes.
them. They'll write a referral letter for them, and they can come to the gynae clinic.
Okay. Thank you very much. Of course, we'll have you back again
It's a pleasure.
very soon. Thank you very much.
Thank you very much.
I'm Angela Ajitumobi. Thank you for watching.